Thank you. Good
Good
morning. How
morning.
are you?
How are you?
I'm doing well. I'm going to apologize to you and to other people that are watching. I do have a little bit of a head cold, so I know it's going to be terrible, but I'm sorry if I cough.
No
um,
worries.
all right. Well, let's go ahead and get started. Thank you, everybody that is watching. I saw a bunch of people pop in, and I'm sure there will be people popping in and out. I'm going to do a little bit of introductions, and then we'll dive into the important conversation. So, for those of you that don't know me, excuse me. For those of you that don't know me, my name is Megan Hansen. I am the co-founder of Recurrent Pregnancy Loss Association. And if you don't know what RPLA is, Recurrent Pregnancy Loss Association is a nonprofit organization for families who um, have experienced recurrent miscarriage. And we do a lot of community building and support and things like these important conversations with experts. We also do a lot to try to advance research because, as so many of us know, there are not a lot of great answers as to why RPL happens. And so a large portion of our focus is on that. And then yeah, we do a lot of advocacy and other events. So if you don't know us, I invite you to get to know us a little better. These Ask the Expert sessions are times where we can sit down and deep dive into a topic that is really relevant for the community. I'm really excited about this one because I think that this is an under-discussed topic and one which is really important in our overall mental health and life health. And so we're going to be talking today about the impact that infertility and recurrent pregnancy loss has on intimate relationships, partnerships. So let me introduce my guest today, Kerri-Anne Brown, who I met at ASRM last year. Kerri-Anne Brown is a licensed mental health counselor in Florida and a certified grief coach. She has been a licensed therapist for 16 years and specializes in perinatal mental health for the last 8 years. Her private practice focuses on infertility, pregnancy loss, birth trauma, and perinatal mood and anxiety concerns. Excuse me. She also does psychoeducational consultations for couples who are planning to use an egg, sperm donor, or gestational carrier, as well as evaluations of potential egg donors or gestational carriers. In her work as a grief coach, she helps clients who are overwhelmed with the grief after pregnancy loss gain tools to navigate the journey with confidence, clarity, and hope through a 6-week program. So welcome. I'm so glad you're here. Thank you for being here. And excuse me. The first thing I'd just like to ask is let you introduce yourself a little bit. How did you come to this work? How did you could have focused on any sort of area of mental health. So how did you come to this space and this population of people? And yeah, tell us a little bit about your journey.
Yeah. I like to say that the work actually chose me and not the other way around.
Yeah.
And when I say that, I mean, I was working predominantly with couples at one point in my practice, and I was noticing that many of them had had experiences with loss, but that wasn't necessarily what brought them into couples counseling with me. But we were identifying how the loss had impacted the current relationship struggles that they were having. And so it was something that we began to kind of like shift the focus on. So it naturally kind of developed into that professionally, but also my personal experience. I have had experiences with birth trauma, premature delivery leading to an extended NICU stay, also a stillbirth. And so that also shaped, who I became as an individual, but also as a therapist. And so I think organically it just kind of helped solidify who I wanted to work with, and what I wanted to focus my practice on. But also, when I was searching for a therapist for myself after my experiences, I had a very difficult time finding someone. And I'm not sure if it was the keyword searches that I was using that made it difficult, or therapists that weren't necessarily like marketing themselves in a specific way that made it easy to find. Whatever the reason was, I struggled to find a provider for myself. So that also helped me sort of realize, okay, there's clearly a need for this. And so that really helped me, get the clarity on where to put my focus for my practice. So here we are.
Well, thank you, and I'm sorry for everything that you went through on your in your personal experience. But I do think that often, excuse me, I'm so sorry. Often that does, yeah, when we have those life changes, it sort of changes the focus of what we want to do then going forward. So I think,
Mm-hmm.
well, um, this is ridiculous. Excuse me, 1 second. Okay. All right. Where I wanted to start the conversation, as we have been emailing, is, there are a lot of people that I talk to that have never sought out, like, they've never seen a therapist
Mm-hmm.
before. They don't know where to start, and it can be kind of a confusing field or endeavor to try to figure out, like, when
Sure.
I mean, it's vulnerable to even admit to yourself that you
That
need
you need
help,
it.
out
Yeah.
how to
Yeah.
go about finding that help. So,
Yeah.
you lay out, like, in the field of mental health care support,
Mm-hmm.
there are psychiatrists,
Mm-hmm.
there are licensed mental health care professionals, there are coaches.
Mm-hmm.
What does everybody do, and how does somebody go about figuring out which is sort of the right direction for them?
Yeah. Yeah. I agree. It can be really overwhelming to navigate all these different options. Um, so so a psychiatrist, for example, right, that's someone who has a medical degree. They've gone through medical training, they've done a residency, they're able to diagnose and treat mental health conditions and prescribe medications for mental health conditions. um, Psychologist has a doctorate, a PsyD or a PhD. They're also able to diagnose and treat mental health conditions, not necessarily prescribe medications. Whereas a licensed mental health provider, they're typically master's level. They are master's level. They're licensed in their state where they practice. They can diagnose and treat mental health conditions, but not prescribe medications for mental health conditions. And a coach has no formal, they're not required to have any formal training or education. They're not licensed. They cannot treat or diagnose mental health conditions. I think that they all can be useful. They can all be helpful. Not all things are helpful for everyone, however. So I think really, if you're not sure where to start, like a lot of providers offer consultations, like a 15-minute consultation where you can do an overview of what your current challenges are, and then they can help give you some guidance as to like what the recommendation is, or do see a therapist, for example, and do that initial appointment for a full evaluation so that they're able to kind of get a deeper understanding of what your needs are and then give you recommendations based on that, so you don't have to figure it all out or have all the answers to get started.
And I will say, I mean, I have taken advantage of those 15-minute consultations
Hmm.
myself, because I think, like, you kind of get a good sense of
Hmm.
somebody, their style, and whether
Yeah.
or not it's a fit for you.
Yeah.
Very that way.
Hmm.
And the other thing I would ask is, today we're talking about couples and the impact that this has on that relationship. But even with that, like, you could seek help as an
Yeah.
individual or in group therapy or as couples therapy. So as it comes to relationship challenges, talk about the pros and cons of those different approaches. Like, if you're
Hmm.
as a couple, do you need therapy as a couple,
Hmm.
or can you do individual therapy or some other form of support?
Yeah. So I would say, um, for if you are having difficulties just working through the loss and the trauma, and it's not necessarily affecting the relationship, because not every couple that has gone through pregnancy loss is struggling in their relationship, right? Some do, but not all. And so if your relationship is not being negatively impacted and things are fine, then you don't necessarily need couples counseling. It can just be individual counseling, and you do that work. But if the loss and how you're coping and the impact of the loss is affecting you relationally, you're having struggles with intimacy or communication or whatever it is, there's some negative impact as a result of the loss, and couples counseling could be super helpful. um, Group counseling is something that we know has shown to be really effective, particularly with this issue, because of the built-in. Sure, go ahead.
No, keep talking. I'll be right back.
Okay. Because of the built-in support system, that's in place. It can be really isolating. And so having a group of people that have had similar experiences, even if their journey looks very different, there is a shared experience that is inherent in that process. And so that's something that a lot of people find really helpful, whether it's group therapy or like a support group or something like that.
I just needed to step away and I think get that up. So thank you for continuing to.
You're welcome.
Um,
This was me a few weeks ago, so I understand.
I like, and it hits you and you're like, I'm totally fine. And then all of a sudden you're
Nope.
like, why can't I say two
Yeah.
seconds? So
Yeah.
I think I need to step away and get it up a little bit. Okay. So now more specifically, like, what is it like to work with you?
hmm
So a couple approaches you and is working with you through these issues. Like, how do you structure your sessions or how do you structure your counseling of the families?
So, um, I like to utilize narrative therapy a lot. I rely heavily on that. And that really is just understanding the couple's story, like the story that they are telling themselves about their experience. And if they're defining their struggles, their reproductive struggles, if they're defining themselves by their struggles or defining their relationship by those struggles. So the narrative is something that I focus a lot on and helping them define what the narrative is. Sometimes we're not conscious of the narrative. And so identifying that, how it's affecting them, and redefining the narrative. So we all have also like a reproductive story, right? Every single one of us, whether we're conscious of it or not, that's just a story that we tell ourselves about parenthood, right? So that's whether we want to become parents or not, how many kids we want to have, how many years apart we want to have them, right? Like all of these details about our story as parents or not as parents if we don't desire to have children. Everyone has their own unique story. And when you've experienced a pregnancy loss or losses, that is something that you have to grieve the loss of the original story, right? Loss is not a part of anyone's story. Like no one thinks about having a loss or planning for a loss as they think about becoming a parent. So redefining that reproductive story and grieving the loss of what the original story was, what it looks like now. And while we may not know what the end of the story looks like, we can't predict the outcome, learning how to live with the uncertainty of that.
So, and that's interesting. You said whether the couple is like defining their relationship or defining their
hmm
narrative by the law around them.
hmm
Is it better or worse to like have that be a defining part of your narrative, or is it more in the how that gets woven into the narrative? Like, is it the importance or the like framing of it? I don't know. I'm not asking the question in the right way, but
No,
like,
I think I understand what you're saying. I think it could be both, but I think particularly um it's so it's part of our story, right? Or this is our story.
yeah,
Those are two different things.
totally, yeah,
Yeah. Yeah.
yeah. No, that's and I can see how for so many of us, I mean, even I would admit that myself, like, and that this is less from like a relationship perspective, but more from like my personal perspective. I think I did tip that scale, like, because it was such a long journey. I think I did tip that scale of like, this is my defining characteristic
Yeah.
of
Yeah.
being a part of
Yeah.
me. And I can see how that changes then the lens that you're looking at everything.
Absolutely. And it's really easy to get to that place, especially if it's something that um you're having numerous experiences with.
Yeah.
Then it's
Yeah.
it's it becomes easier to define yourself by that. It's like, well, this is my life now. This is who I am. This is who we are. This is, and like you said, the longer that you're in that place, right? Like if this is something that's happening years and years and years and years, it's so much easier to define your life by that.
Um, so I mean that kind of takes me into the next question, which is, you've counseled many couples that have experienced these unfortunate circumstances. What are the like, I mean, what would you say are the most common themes or the most, yeah, the common challenges that people are dealing with? Like, help us all feel normal. No.
Who common man. So common themes are um layers of loss. really, like an onion that you're peeling back, right? So you've got the primary loss, which is the loss of like this baby that you were hoping for, and then all these secondary losses associated, you know. And a big part of that is like the loss of identity, you know. Maybe before you were someone who had no health issues, everything had been going fine in life all along up until this point, and now maybe you're someone who has gotten, you know, some fertility related diagnosis, and now like you're all of a sudden not a healthy person to someone who's struggling with health issues, you know. So like this change in identity, loss of sense of self, um loss in confidence, shame. That's a big one that comes up for a lot of people, a lot of couples, you know, navigating social situations with friends who are seemingly having no difficulties with their reproductive lives and just having babies easily, and you're struggling, and you know, figuring out how to navigate those relationships in the midst and height of grief, you know. And so that can lead to a lot of isolation, you know, and that's hard, you know. So that can also kind of like be a new experience of another type of loss, because these changes in relationship can be its own form of loss for people. um so these layers of losses, these secondary losses, there's the disconnect that a lot of couples can experience with differences in grief responses and grief reactions, you know. I don't want to generalize necessarily because there's always exceptions, but typically, you know, men and women, for example, their grief responses kind of look different, and that can create disconnect where, you know, or a misunderstanding of like, well, your grief response is very different from mine, so perhaps you're not grieving as much as I am, you know, just interpreting those grief responses very differently and feeling disconnected. I think too, what comes up a lot is issues with intimacy, you know, because with the grief, pregnancy loss, it can result in a lot of trauma for people. And when we've had traumatic experiences, a trauma response can be avoidance. And so that might lead to an avoidance of sex, for example, you know. And we also know that sex is something that can help partners feel more connected. So that can become a struggle for partners, and communication level needs, varying needs and levels of communication. Maybe one partner wants to talk about it a lot, needs to talk about it a lot, and the other person doesn't necessarily want to talk about it because it's too painful. And so the communication gap can also lead to disconnection. You know, so you have all these things going on that, you know, can cause issues in relationships following a loss.
Yeah, I'm like, I'm listening and I'm like, yes, that was,
Check, check.
that's,
Yeah,
yeah, yeah, exactly.
very common. Very, very common.
So um, I mean, let's first talk about like the different ways that people grieve. And I don't know, I mean, it's not surprising that there are like, in a broad generalized terms, like difference between genders, or I don't know if it's like, you know, birthing and non-birthing partner, but like, let's
Hmm.
tell a little bit more about what are the different ways that grief looks like, and
Hmm.
when you have two people who are either in different phases of grief or grieving differently,
Hmm.
how do you go about the process of like even identifying what you need and asking for the support you need while simultaneously trying to show up for somebody else? Like,
Hmm.
how do you
Yeah,
work those things?
yeah, that's hard. You know, it's hard because it can look like so many different things for people. And so
Yes.
that's what makes it so difficult to identify, because you can have someone who seemingly appear like they're doing okay and they're really not. You know, they're like wearing a mask to be strong, to appear okay, and they're really not. And so, um, for example, you talked about like the differences with like the birthing partner and the non-birthing partner and ways that that can show up. So the impact might look different. Like they're both grieving, but the impact of the loss can show up differently. So for the birthing partner, you know, like they, depending on how the loss occurred, right? Like, you know, whether it was early loss or like a later term loss, like all of those things can also impact what the grief response looks like, and how they're coping. So for the birthing partner, they're often struggling with like feelings of like, well, I talked about shame before. but also like feeling a sense of like self-blame. Like, what did I do? Did I do something to cause this? What could I have done differently? Just lots of self-doubt. Like, was it me? Was it something I did or didn't do? Um, and becoming a little ruminating on like what could I, just researching all the things, especially if there wasn't like a known cause or explanation. That can be really difficult because the need for answers becomes really significant. When it cannot be explained, we're logical beings. Like, we need to make sense of our experiences. And when we can't do that, we're searching for answers. And sometimes when we can't find the answer, well, clearly it's me, right? Like, that might make the most sense, and it gives you an explanation in the absence of one. um so internalized shame and blame. Whereas for the non-birthing partner, it is a sense of like helplessness. Like, they are watching their partner have an experience with their bodies that they can do absolutely nothing about, and so like that sense of helplessness is there, which can also create the need to like fix or problem solve, which is hard because sometimes there isn't a solution, or it's not a problem that can just be easily fixed. And so they're experiencing their own sense of helplessness and sometimes their own sense of, blame, as well. So, um, for males in particular, sometimes the coping pattern looks like, again, because they're not able to fix, like they will end up doing things where they feel like they have some control over that. So that might look like pouring themselves into work, working a lot of hours, staying busy, um, which creates its own issues because then the birthing partner might feel like they're not being supported as much as they want to, um, because one person's like really busy working a lot and not necessarily as present as the partner might need them to be.
The next, I mean, the how, like with what you've said about sort of the differences and, wanting to fix or feeling like sometimes it's so difficult to be aware about your grief.
Mhm.
Are there steps that people can take to better identify what it is that they really need and support to be able to
Mhm.
better ask for it from their partner?
Mhm. Mhm. Yeah, I think it's really helpful to like have a basic. I think grief education is really important. Like, that's not something that we all necessarily have. Like, we're not learning in school how to manage grief, right? So like, when you have this experience, it's something that you're having to like figure out. And for some people, they've never had a loss before, had any type of experience with grief before, this type of grief. And so there's like this huge learning curve, and a lot of faulty expectations, or faulty beliefs about what grief is, what it isn't. There's a lot of misinformation out there. And so that might lead to people being confused about their own grief experience and feeling like they're grieving wrong, or they're grieving too much or too long, all of these things, which can, only further just make things harder. And so I think just educating yourself, on what are some normal, common, I would say, experiences, with grief. And I think it's important to not pathologize grief, though, right? Like, grief is a normal response and reaction to a loss. So it's normal to grieve, I think when the grief is becoming all consuming, it's affecting, how you're functioning, you're not sleeping, you're not taking care of yourself, it's affecting your relationships, like, then that's probably an indication that you need some support, you know?
Yeah, that's a really good point. Yeah, yeah, we not pathologize it. Yeah, that's a really that's noted. And then like so to take that into asking what we need for, but then like how do you show up then in your own grief? What can you do to show up for somebody else also in theirs. Like,
Yeah.
right, you know, so there's what I need and how I ask for it, but there's
Yeah.
also then what you need and
Yeah.
what I can support you while also supporting myself. Like,
Absolutely.
really
Yeah.
good about how,
Yeah.
yeah.
Absolutely. And the needs might look different. They may not mirror one another, right? And so like that requires a lot of conversation and dialogue um about what you need and what I need, and just asking questions, to try to understand your partner's grief experience. Like not assume like, okay, well we both had this loss, right? Like we both share this loss, and so clearly it's having the same impact. No. Right? So like asking questions to deepen your understanding. How is this affecting you? What is your experience with this? How are you feeling? What will be helpful? What's not helpful, right? Like having conversations, asking questions to understand, seeking to understand, not seeking to fix, right? But like to understand. Um, and asking, for what you need, because I think of it like almost like the love languages where you're like, I like to receive love a certain way, so therefore that is how I'm showing love to someone else. But that might not be how they receive love or feel loved or supported. So it's a similar thing. I might need a specific type of thing from my partner to feel supported and to help me in my grief. My partner might need something entirely different from what I need, and so it's giving the support that is needed by your partner and not the support that you need or you think that they should need, you know?
Like asking the question, like sort of being curious about what it
Yeah,
is.
yeah, lots of curiosity. And then also having ongoing conversations about it, because we need to understand that needs evolve. Like they don't stay the same, right? So like maybe at one point in your journey you need something specific, and another point that thing is no longer useful or helpful. You don't need it anymore, right? So our needs are going to evolve over time. And so we need to continue to check in and continue to have these conversations about what the current ongoing ever-changing needs are.
So this is going to be a clunky transition, but I want to transition to the next topic, which is really about like sex and intimacy. And you brought it up that like a lot of these reproductive challenges like create this trauma
Yeah.
experience related to sex. And like what, I guess, how does that show up? Number one, maybe we'll
Hmm.
start there. Like what, how does that actually like play itself out in a dynamic
Hmm.
couple?
Hmm. Yeah. So some common ways that that might show up. I talked earlier about like shame, you know, internalized shame of like something is wrong with me, I was not able to do this thing that my body should know how to do, should do naturally. So this internalized shame, feeling bad about your body, even for, again, depending on the type of loss, like some losses, later term losses where you had to go through a delivery, for example, and your body was changed by this pregnancy, and you're having to recover from childbirth, or something like that, and just not feeling great about your body in general, and so that can also lead to difficulties with like intimacy. I think too, when you are experiencing intense grief, that can present itself as like just feeling depressed, high anxiety, like those things impact libido and desire, and so that's also going to affect intimacy. Again, if there's like a disconnection in how you are both grieving and not feeling connected, that also is going to naturally you know create issues with that as well. So there's all these things that are happening that can affect. I think with infertility, especially if you're going through treatments and like there's the hormone stuff. Sex is feeling scheduled and not necessarily something that it feels like a chore. So that also makes things difficult as well.
And is it like, is it the type of thing where it's like, hey, this is a season and like it will get better, which certainly some of that.
Hmm.
What can like, or like what can people do to maintain that like intimate connection, even if maybe the like the sex piece of it has changed, you know. So,
Mm-hmm.
and
Mm-hmm.
my own therapist would tell me like intimacy is a broad term and sex within it.
Mm-hmm.
How do you, and I, you know, so you can talk, you talk what I
Yeah,
talk
yeah,
about.
for sure. You can focus on other aspects of intimacy that's
Yeah.
not visible. Yeah.
Like
So
how,
there's that.
yeah.
Yeah, other aspects of intimacy that's not physical. And I think about what I said earlier about defining the relationship by this struggle, by this experience, right? Like outside of this, who are you guys as a couple? What do you like to do? How do you spend time together? What's fun? What keeps you guys, connected and things like that? Like going back to what was life like before this? you know, Rediscovering your joy and rediscovering that part of life, because again, this is just a part of your story. It's not your entire story. You're not defined by this. And so outside of this, who are you guys as a couple? And you may need to like rediscover that or redefine that, and so taking the time to do that, I think too, loss is a way sometimes of like changing people. And so maybe it is like you're feeling disconnected because your partner is so different from who they were before, and so maybe you need to get to know this new version of them.
Yeah. Yeah. I love that. And it ties back, the way that ties back into like, what is your story? Like, who were you?
Hmm.
Even this aspect of your relationship is only one part of your relationship. And so,
Yeah.
yeah,
Yeah.
that's, and so, how do you like, is that, what are some things that like, how can that actually functionally look like? Like if
Hmm.
I'm needing to go back and kind of rediscover the parts of my relationship or learn how my partner has changed, like what does that
Hmm.
look like, or what
Yeah.
do?
I mean, you can almost treat it like you're getting to know somebody for the first time, right? Like, so I encourage a lot of exploration, like, because couples may not know, like they may feel so far removed from that part of their lives that they're like, I don't even know what we did for fun before this. Like, this has taken up so much air and space in our lives that we don't even remember. We don't even know. That's okay. We can explore, um, and discover and try new things, try new hobbies. Sometimes it means cultivating new community, like, because if you're in community with people who can't relate to your experience, there's no one else in your circle that has had an experience like this, like you can feel a lot of isolation and disconnection, and so maybe creating new meaningful connections where you're feeling understood and seen and supported, and that can be really helpful.
um how, like, now to kind of get into the pieces of the, a lot of this I think probably comes back to like communication, but to take it from sort of supporting one another through grief, like maintaining that element of uh, we as a couple outside of this experience, but then when it comes to this experience of infertility, of pregnancy loss, of family planning, often these long journeys have a lot of decisions that people are not never having to make. And I know, like in your bio, even you're doing a lot of counseling with people that are wanting to use third party or any of those things. Like, how do you counsel people to go through these decision making processes, particularly when there might be like areas of disagreement?
Hmm. Yeah. So I see a lot of couples feeling a sense of urgency of like, we've got to figure this out. We've got to figure out what the next step is, what we're doing, how, when, and so I try to like decompress that, like the sense of urgency, because I think when it feels urgent, our ability to make these important decisions it's like impaired because we're making it out of like a sense of desperation sometimes, and that's not always the best place from which to make decisions, and so maybe we just need to be in an information gathering space where we're just gathering information. We're not making any decisions. No decisions are being made right now. We're just collecting information, right? And so it's like if I'm going shoe shopping, and I have to try on different sizes. So I have this one option here. Let's try that on for size. Let's talk about that. How does that feel? Does it feel like a good fit? Right? All right, let's put that one down. Let's try this other one
Right.
on for size. How does that feel? no decisions are being made. We're just exploring and seeing how these different options feel. Um, so that it takes away again the urgency of like we need to make this decision, like we're not making any decisions right now. And so that can create its own sense of relief of like, okay, I don't have to make any decisions, I don't have to make any choices. I'm just gathering information, and that sometimes can feel like an easier thing to do for people.
And that's so, I mean, the sense of urgency, both in making the decisions and just in general. I mean, with all of this, like, particularly, I think this is probably more of the, like, I don't know, female experience of it, but like, oh my gosh, time. Every day I'm like losing time.
Yeah,
So what,
yeah.
how do you create that space for yourself to make those decisions? Like, how do you actually kind of,
Mm-hmm.
yeah, give
Mm-hmm.
that breathing room?
Yeah.
Because it is sort of a forced function that we do to
Yeah,
ourselves.
for
Yeah.
sure. For sure. So I think about it like you want to make the best decision here,
Yeah.
right? And in order to do that, you need as much information as you can gather to make the best decision.
Yeah.
And so there's that, or we just need to make a decision because I just need to know what's happening next and what we're doing. And so we're making a decision for the sake of having a decision made, but it may not be the best decision,
Yeah.
So I want to make a decision that you want to make a decision that you feel as confident as you can be, right? Because you may never get to where you're like, this is best thing ever. Because there might be decisions that you're having to make that, aren't necessary. I mean, this wasn't first choice, right? Like this isn't what you really want. You're just forced to have to explore other options maybe, or look at other things that you never thought you'd have to be looking at. And so we can acknowledge that none of these are ideal, right? This isn't like preference here, but if these are options, let's gather whatever information that we need so that we can make the best decision and be, just confidently make the choice that feels right for us right now. And that can be difficult when you have partners that aren't necessarily on the same page about that. And so that's where couples counseling can be helpful in trying to understand, well, why is this decision so important to you? What's the significance of this for you? And trying to really understand what's underneath that and driving that, and helping the partner to understand like there's this decision, but underneath that, like what's underneath that for this person.
And often it takes time to like figure that out
Mm-hmm.
sometimes.
Mm-hmm.
But I mean, I think that's really, we, you know, when we were coming to that point of like deciding not to continue trying ourselves, like we talked to a lot of parents that had, you know, built their families through adoption. We
Mm-hmm.
talked to people that had used gestational surrogates. Like we did a lot of that, just kind of information collection to
Yeah.
say that feels like it would make sense, the most sense for us. Yeah.
Yeah. Mm-hmm. Yeah. And sometimes you don't even know what your options are. So you also have to take the time to see what is available for you. Like what are options, and just because an option exists doesn't mean it's an option for you either. And so I think again that information gathering I think is really, really critical.
Are there any um are there any resources that you like typically point your clients to? Are you, I mean, do you have like I tell most people to read this book, or I
Mm-hmm.
like tell people to read this blog. Like, do you have go-to kind of resources to help people educate themselves around some of, I don't know, these difficult things about
Mm-hmm.
couples
Mm-hmm.
differently, or communication through infertility? I don't
Yeah.
know.
Yeah. So of course I love ASRM, American Society of Reproductive Medicine. I think they have really great resources. That's one resource in just understanding about infertility and things like that. Resolve is another one that I often point people to. PSI, Postpartum Support International. They have resources. They have support groups, a robust library of support groups for different types of losses, different stages of loss, things like that. Um, and then again, I give education on like this is an option, this is an option, this is an option. Talking with your providers. Doing consultations, whether it's with a reproductive endocrinologist or just again getting information from your providers to again have all of the data to look at to be able to assess what feels like the right next thing, because you just have to kind of take it one step at a time, you know.
And you mentioned PSI, which they are a great organization. I'm glad you brought them up. Which kind of, I mean, Postpartum Support International. One of the things that I gratefully there is many people now that I've been doing, like, now that this organization has existed for a while, that have gone through they've had a big journey, and now they're parents. Now
Mm-hmm.
they're when your narrative as a couple has been so much about loss
Loss.
or
Yeah.
infertility,
Mm-hmm.
and you become a parent, that shift of identity plus the challenges like early parenthood,
Parenthood.
a lot.
Yeah.
How do you help people navigate that transition, and how does the one impact the other? Like, if you're coming into parenting carrying all this baggage of grief,
Mm-hmm.
what is that?
Mm-hmm.
How can we make sure that that doesn't create problems?
Yeah. Yeah, for sure. So yeah, it's a huge shift in a reproductive identity. Like you said, because for so long you were defining your life and your relationship through the lens of loss. And then now it's shifted to like, now I'm a parent with a living child, And so it's having a living child doesn't negate all the years or however long, right? Like everything that happened prior to that. It doesn't negate the loss, it doesn't negate the grief. And so a lot of it is learning how to hold space for both the grief of the loss or losses and the joy and hope of like this new life that you have, and I think a lot of people end up struggling with like how do I hold room for both, because they are like two seemingly opposing experiences that should not coexist, but yet somehow they do, you know and so parents often are wanting to figure out how to make room for that in terms of honoring their losses so that they're not feeling like, okay, well, that chapter's closed. Let's put that, bury that and like never look back and move forward, and then feeling the guilt of letting go or forgetting about, the babies that they've lost. And so we talk a lot about how to integrate that loss into their new lives. Um, and that feels often a lot better for them to feel like they have this like integrated story versus like the life before and the life after, and they're two totally different lives that should not be anywhere near one another.
I like that, like a woven tapestry almost.
Yeah, yeah, yeah.
We're coming. I mean, we've got about 10 minutes left to that hour. What I would like to kind of transition to is sort of, I don't know, advice for families and advice for other people. Like, what do you wish? I'm sure, and what do you wish that care providers, any type of care providers, other mental health care professionals, that this might not be their area of expertise, or physicians, nurses, like, what do you wish that they understood a little bit better about this experience and how it impacts couples?
Mm. I wish I wish that people understood that grief doesn't happen in a vacuum. It really does affect every area of a person's life. And I think that that's important for us to really understand that and to make room for conversations with people about it and asking them about it. Right. I don't think we're asking people enough. And not asking about it and making room for those conversations only promotes more isolation, because people feel like they can't talk about it. They're not going to just bring it up. But if you ask them about it, like they probably will talk about it. That it's like giving them permission to talk about it because you're making space for that. And so I think that we can do a better job in asking people about their experiences and how they're doing, what they're needing, and helping connect them, with helpful resources. Because there are resources out there, but again, you don't know what you don't know. Like you're navigating this like new world and trying to figure out, all of this and understanding, how to live with this experience. And it's really overwhelming. you know, and you don't know what you don't know. And so I think just through conversation, like you can learn a lot just through asking simple questions, showing interest. Yeah.
No, and I think I mean, I love that advice because it goes to like well beyond the question I asked, but like, everybody we should sort of be doing that. But I'm always shocked with like how I yes, I think I ought to have been asked more. That's
Yeah.
wonderful advice.
Yeah. Yeah.
On the flip side of it, people watching this that are really struggling to grow their family, that are maybe really struggling in their relationship.
Hmm.
What do you hope their main takeaways from this conversation are? Like, what would the kind of key things that you would hope that they get from you?
My hope is that the biggest takeaway, I think that that would be the most impactful, would be to know that we are not defined by our reproductive experiences. As impactful in our lives as they don't define us. We're so much more than that.
Yeah, yeah. And it's so hard to have that perspective when you're in it, but to know that you're more than just this one element of yourself. Yeah,
Hmm.
that really is, I think, the key to so much of it. Yeah. Um, Karen, how do people find you if they want to work with you, if they want to follow you? Like how, what are the options that you have for people to yeah, work with you?
Find me. Yeah. So on Instagram, I'm Healing with Wisdom Counseling, and then my website is healingwithwisdom.com. Those are the two easiest,
Yeah.
biggest ways to find me.
Do you, I mean, but are your clients all Florida or southern states? Like where can you, yeah,
Yeah.
like your clients,
So for my counseling clients are all limited to Florida for the counseling that I do. The grief work that I do centered mostly around grief education and walking people through like this grief journey after loss and redefining themselves outside of their loss experience. I have a 6-week coaching program that does that. And that's not limited to Florida. I can work with anyone anywhere for that. It's virtual. And so there's a page on my website for that as well if they're looking for more information on that.
well, I hope people, I think it's important work. You know, the, if I could go back and do if I could go back and like sort of rewrite my own story, I think I would have sought out a different level of help earlier on. It would have made
Mhm.
a difference. So I want to, people like you are so important and such critical to helping so many of us get through this really trying phase of life.
Mhm.
Thank you. And thank you for the conversation today. I apologize again for,
It's okay. I hope you feel better.
I feel
I'm listening.
just sometimes it hits you and it's
Mhm.
like, yeah. So.
Well, thank you, Megan.
Well, thank you. I'm glad that this worked out, and hopefully, this is good tips for people in this month of Valentine's Day. Relationship
Mhm.
topic was a critical one. So,
Yeah.
all right.
Yeah.
Thanks so much, Kerri-Anne.
All right. Bye.
All right, bye.